हेलो एवरीवन, वेलकम टू नर्सिस एकेडमी। आज के हमारे MCQs के टॉपिक है ग्लासगो कोमा स्केल टर्म्ड एज GCS। क्वेश्चन नंबर 1, द ग्लासगो कोमा स्केल वाज डेवलप्ड इन ऑप्शन ए 1974, ऑप्शन बी 1980, ऑप्शन सी 1969, ऑप्शन डी 1992। करेक्ट आंसर इज ऑप्शन ए 1974। Question number 2, the GCS measures option A consciousness level, option B heart rate, option C reflexes, option D muscle tone. Correct answer is option A consciousness level. Question number 3, GCS was developed by option A Tisdale and Janet, option B Pavlov and Freud, option C Watson and Crick, option D Pearson and Brown. Correct answer is option A Tisdale and Janet. Question number 4, total components of GCS are option A 3, option B 4, option C 5, option D 2. Correct answer is option A 3, eye opening, verbal response and motor response. Question number 5, maximum score for eye opening is option A 4, option B 5, option C 6, option D 3. Correct answer is option A 4. Question number 6, eye opens spontaneously. Eye opening response would be recorded as option A 4, option B 3, option C 2, option D 1. Correct answer is option A 4. Question number 7, eye opens to speech. E score would be option A 3, option B 2, option C 4, option D 1. Correct answer is option A 3. Question number 8, eye opens to pain. E score would be option A 2, option B 3, option C 4, option D 1. Correct answer is option A 2. Question number 9, no eye opening at all. E score would be recorded as option A 1, option B 2, option C 3, option D 4. Correct answer is option A 1. Question number 10, maximum verbal score is option A 5, option B 6, option C 4, option D 7. Correct answer is option A 5. Question number 11, if a patient is oriented and talks normally, verbal response would be considered option A 5, option B 4, option C 3, option D 2. Correct answer is option A 5. Question number 12, for a patient with confused conversation, verbal response would be scored as option A 4, option B 5, option C 3, option D 2. Correct answer is option A 4. Question number 13, for a patient with inappropriate words, verbal response would be considered option A 3, option B 4, option C 2, option D 1. Correct answer is option A 3. Question number 14, if a patient makes incomprehensible sound, verbal response would be considered option A 2, option B 3, option C 4, option D 1. Correct answer is option A 2. Question number 15, points for no verbal response at all is option A 1, option B 2, option C 3, option D 4. Correct answer is option A. If a patient shows no verbal response at all, then verbal score would be 1. Question number 16, for intubated patients, verbal score is recorded as option A 2, option B 1, option C not testable, option D 0. Correct answer is option C, not testable. Question number 17, maximum motor response score is option A 6, option B 5, option C 4, option D 7. Correct answer is option A. Maximum motor response score is 6. Question number 18, if a patient obeys command, motor response would be option A 6, option B 5, option C 4, option D 3. Correct answer is option A 6. Question number 19, if a patient is localized to pain, motor response would be recorded as option A 5, option B 4, option C 3, option D 6. Correct answer is option A 5. Question number 20, a motor response of withdrawal from pain often scored as option A 4, option B 3, option C 2, option D 1. Correct answer is option A 4. Question number 21, in case of abdominal flexion, decortical posture, motor response is scored as option A 3, option B 4, option C 2, option D 5. Correct answer is option A 3. Question number 22, in case of abdominal extension, decerebrate posture, motor response is scored as Option A 2, option B 3, option C 1, option D 4. Correct answer is option A 2. Question number 23. No motor response to any stimuli. M would be recorded as option A 1, option B 2, option C 3, option D 4. Correct answer is option A 1. Question number 25. Maximum total GCS score is option A 15 points, option B 12 points, option C 14, option D 10. Correct answer is option A 15 points. Question number 25. Minimal total GCS score is option A 3 points, option B 4, option C 0, option D 5 points. Correct answer is option A 3 points. Question number 26. At which GCS score is intubation generally recommended? Option E 12 or less, option B 10 or less, option C 8 or less, option D 6 or less. Correct answer is option C. Intubation is generally recommended if a patient's GCS is 8 or less than 8. Question number 27. In a GCS score of 13, the most likely deficit is in option A eye opening, option B verbal response, option C motor response, option D pupillary reaction. Correct answer is option B verbal response. Question number 28. A nurse assesses a trauma patient who opens eyes to speech and is oriented and converses normally and obeys commands. What is the condition of the patient? Option A severe head injury, option B moderate head injury, option C mild head injury, option D deep coma. Correct answer is option C mild head injury. We calculate GCS. We said that patient open eyes to speech, so eye score would be 3 and is oriented and converses normally, so verbal response score would be 5 and obeys command, and motor response score would be 6. 3 plus 5 plus 6 is equal to 14 out of 15, so total score is 14 out of 15 and it indicates mild head injury. Question number 29. A patient comes to emergency department after a minor road accident. He opens eyes spontaneously, obeys commands and talks in a confused manner. What is the total GCS score? Option A 15 out of 15, option B 14 out of 15, option C 13 out of 15, option D 10 out of 15. Correct answer is option C 13 out of 15. Now we'll check that patient open eyes spontaneously and that eye score is 4. Obeys command, verbal score is also 4 and talks in a confused manner. So motor score would be decreased till 5. So if we count these 3 scores, then it would be 4 plus 4 plus 5. It would be 13 out of 15 and it indicates mild head injury. Question number 30. A patient with a mild head injury responds to verbal command, use inappropriate words and localizes pain. What is the GCS score? Option A 12 out of 15, option B 13 out of 15, option C 14 out of 15, option D 10 out of 15. Correct answer is option A 12 out of 15. Eye score would be 3, verbal score is 3 and motor score is 6. So 3 plus 3 plus 6 is equal to 12 out of 15. That indicate also mild head injury. Question number 31. A nurse observes that a patient opens eyes to verbal command, utters inappropriate word and localizes pain. What is the interpretation? Option A GCS 15 fully conscious, option B GCS 8 severe head injury, option C GCS 11 moderate head injury, option D GCS 9 severe head injury. Correct answer is option C GCS 11 and that indicate moderate head injury. Question number 32. Which of the following symptom is most commonly seen in a moderate head injury? Option A no loss of consciousness, option B loss of consciousness lasting 30 minutes to 24 hours, option C coma lasting more than 24 hours, option D only headache with no confusion. Correct answer is option B loss of consciousness lasting 30 minutes to 24 hours. Question number 33. A patient is drowsy, opens eyes to speech, uses inappropriate words and flexes to pain. What is the GCS score? Option A 9 out of 15, option B 13 out of 15, option C 15 out of 15, option D 7 out of 15. Correct answer is option A 9 out of 15. Because patient opens eyes to speech, so eye score would be 3, use inappropriate word, then verbal score would be 3 and flexes to pain, so motor score would be also 3. 3 plus 3 plus 3 is equal to 9 out of 15. so that indicate lower end of moderate head injury. Question number 34. When the GCS score is 13, which level of consciousness is most accurate? Option A, fully conscious. Option B, drowsy or confused. Option C, unconscious. Option D, comatose. Correct answer is option B, drowsy or confused. Question number 35. Patient open eyes to pain, makes incomprehensible sound and shows abnormal flexion to pain. What is the GCS score and condition? Option A, 12 out of 15. Option B, 7 out of 15. Option C, 9 out of 15, moderate head injury. Option D, 14 out of 15, mild head injury. Correct answer is option B, 7 out of 15, severe head injury. Patient only opens eyes to pain, so eye score would be 2. Make incomprehensible sound, then verbal score would be recorded as 2, and shows abnormal flexion to pain, so motor score would be scored as 3. So that would be 7 out of 15, and that indicates severe head injury. Question number 36. A patient after head trauma is unresponsive, open eyes only to pain, make incomprehensible sound and shows extensions, decerebrate posture. What is the total GCS? Option A, 8 out of 15. Option B, 6 out of 15. Option C, 10 out of 15. Option D, 12 out of 15. Correct answer is option B, 6 out of 15. Because patient open eyes only to pain, then eye score would be 2. Make incomprehensible sound, verbal score would be also 2, and shows extension, decerebrate posture. So motor score for decerebrate posture is 2. Then we will count 2 plus 2 plus 2 is equal to 6 out of 15, and that indicates severe head injury. Question number 37. Nurse assesses a comatose patient who shows no eye opening, no verbal response and extension to pain. What is the patient's GCS and interpretation? Option A, 4 out of 15, severe head injury. Option B, 8 out of 15, moderate head injury. Option C, 10 out of 15, mild head injury. Option D, 15 out of 15, normal. Correct answer is option A, 4 out of 15, severe head injury. Because patient shows no eye opening, so eye score would be 1, and giving no verbal response score should be 1, and is showing extension to pain, so motor score would be recorded as 2. 1 plus 1 plus 2 is equal to 4 out of 15, and that indicate deep coma or severe head injury. Question number 38. A nurse finds a patient with no eye opening, no verbal response and no motor response. What is the patient's GCS condition? Option A, 3 out of 15, deep coma, severe head injury. Option B, 6 out of 15, moderate head injury. Option C, 10 out of 15, mild head injury. Option D, 15 out of 15, normal. Correct answer is option A, 3 out of 15, deep coma, severe head injury. Now we will check how the GCS is 3. Because patient have no eye opening, then eye score would be 1, no verbal response, for V score would be 1, and for no motor response, M score would be also 1. 1 plus 1 plus 1 is equal to 3 out of 15, and that indicate depressed coma and severe head injury. Question number 39. A patient with a GCS of 8 out of 15 is admitted. What is the immediate nursing priority? Option encourages oral fluid. Option B, maintain airway and oxygenation. Option C, provide family teaching. Option D, allow the patient to rest alone. Correct answer is option B, maintain airway and oxygenation. If the patient's GCS is 8 or less than 8, that indicates severe head injury and is a risk of airway compromise. So priority should be airway management and neuromonitoring. Question number 40. Nurse notices the patient's pupils are equal and reactive to light. What does this indicate? Option A, brainstem is intact. Option B, increased intracranial pressure. Option C, brain herniation. Option D, midbrain damage. Correct answer is option A, brainstem is intact. Normal, equal and reactive people show proper brainstem functioning. So patient GCS would be 15 out of 15. Question number 41. A patient with unequal pupil anisocoria after head injury may have option A, early sign of brain herniation. Option B, normal variation. Option C, liver dysfunction. Option D, eye infection. Correct answer is option A, early sign of brain herniation. Unequal pupil suggest increased intracranial pressure on one side. Question number 42. When assessing a patient with GCS 8, the nurse finds non-reactive dilated pupil. What does this suggest? Option A, hypoglycemia. Option B, severe brain injury. Option C, normal finding. Option D, dehydration. Correct answer is option B, severe brain injury. Fixed dilated pupils shows poor brainstem reflexes, and that indicates severe neurological damage. Question number 43. The nurse uses a pen light to check people's reaction. Which of the following findings is abnormal? Option A. Both people constrict equally. Option B. One people fixed and other reacts. Option C. People round and equal. Option D. Both people constrict briskly. Correct answer is option B. One people fixed, the other react. If the one people is fixed and the other react, that indicate possible cranial nerve. 3. Oculomotor nerve compression. Question number 44. During neurological assessment, sluggish people reaction usually indicates option A. Early increase in intracranial pressure. Option B. Hypotension. Option C. Normal response. Option D. Improved brain perfusion. Correct answer is option A. Early increase in intracranial pressure. Raised ICP compresses cranial nerves, so slowing people response. Question number 45. A patient's pupil are pinpoint and non-reactive. Which condition should the nurse suspect? Option A. Opioid overdose or pontine lesion. Option B. Brain death. Option C. Alcohol intoxication. Option D. Anxiety. Correct answer is option A. Opioid overdose or pontine lesion. Pinpoint pupils are classic in opioid toxicity or pontine damage. Question number 46. Which cranial nerve controls pupil constriction during light reflexes testing? Option A. Cranial nerve 2. Option B. Cranial nerve 3. Oculomotor. Option C. Cranial nerve 5. Trigeminal nerve. Option D. Cranial nerve 7. Facial nerve. Correct answer is option B. Cranial nerve 3. Oculomotor nerve. Oculomotor nerve regulates constriction of pupil in response to lights. Question number 47. In a patient with GCS 7, pupils are fixed and dilated. What should the nurse do first? Option A. Document and continue care. Option B. Inform the physician immediately. Option C. Measure PP only. Option D. Wait and reassess in 2 hours. Correct answer is option B. Inform the physician immediately. If the patient's GCS is 7 and pupils are fixed and dilated, that indicate potential brainstem herniation and it's an emergency. Question number 48. If a patient has GCS 15 and normal pupil reaction, this finding indicates option A. Normal brain functions. Option B. Moderate head injury. Option C. Severe brain injury. Option D. Confused state. Correct answer is option A. Normal brain functions. Full GCS plus normal pupils, that indicate healthy neurological status. Question number 49. A nurse notes bilateral dilated pupils and absent light reflexes. What is the most likely cause? Option A. Brainstem death. Option B. Mild concussion. Option C. Hypothermia. Option D. Sleep. Correct answer is option A. Brainstem death. Absence of light reflex in both eyes shows brainstem is not functioning. Question number 50. The most reliable part of GCS is option A. Eye. Option B. Verbal response. Option C. Motor response. Option D. Reflexes. Correct answer is option C. Motor response. Question number 51. GCS assessment should be avoided in option A. Intubated and sedated patients. Option B. Awake patients. Option C. Trauma cases. Option D. Postoperative ward. Correct answer is option A. Intubated or sedated patients. Question number 52. In pediatric GCS, which category is modified? Option A. Motor response. Option B. Verbal response. Option C. Eye. Option D. None of above. Correct answer is option B. Verbal. Question number 53. Pediatric GCS is used for children below. Option A. 12 years. Option B. 5 years. Option C. 15 years. Option D. 18 years. So, correct answer is option B. 5 years. GCS is used for children less than 5 years. Question number 54. Decorticate positioning indicates lesion above. Option A. Brainstem. Option B. Midbrain. Option C. Pons. Option D. Medulla. Correct answer is option A. Brainstem. Question number 55. Decerebrate posturing indicates lesion at option A. Brainstem. Option B. Cerebral cortex. Option C. Spinal cord. Option D. Thalamus. Correct answer is option A. Cerebrate posturing indicates lesion at the brainstem. Question number 56. Pupillary reaction is option A. Not part of GCS. Option B. Part of GCS. Option C. Motor response. Option D. Verbal response. Correct answer is option A. Not part of GCS. Pupillary reaction is not part of GCS because it assesses brainstem function. Part of the GCS are just 3: eye opening, verbal response and motor response. Question number 57. Which GCS component is affected most by sedation? Option A. Eye. Option B. Verbal response. Option C. Motor response. Option D. All equal. Correct answer is option B. Verbal response. Question number 58. Best eye response is option A. 4 points. Option B. 5 points. Option C. 3 points. Option D. 2 points. Correct answer is option A. 4 points. Question number 59. Best verbal response is option A. 5 score. Option B. 4 score. Option C. 3 score. Option D. 2 score. Correct answer is option A. Best verbal response score is 5. Question number 60. Best motor response score is option A 6, option B 5, option C 4, option D 3 points. Correct answer is option A 6 points. Thanks for watching. Subscribe for more videos.